Sasa vile sisi hospitali hii alikuja, kwa mgonjwa naingia karibu, kwa mtoto mgonjwa naingia saa yote, hata usiku hata mchana.
Welcome to the program. This is a continuation of Health in Devolution, a look at the status of health services at county level 3 years in devolution. I'm your host, Alex Chamwada.
Before the central government, we only had 2 doctors. People reached to the hospitals in time.
We've experienced exodus of staff to other counties.
Anaambia daktari hayuko, anaenda kutafuta nyumbani kwake.
We have to have a national policy so that all the counties operate according to that policy.
We will draw examples from the following counties: Kakamega, Kitui, Tana River, Garissa, Marsabit, Nyeri, Meru, and Turkana. But first, here is a look at our fact sheet. Three years into devolution, and observers say the number of health facilities within counties has increased. The distance to a health facility is reducing. But some of the challenges, according to the Commission on Revenue Allocation, are delays in release of funds, inadequate medicine, congested wards, inadequate staffing, low staff morale, and non-harmonization of salaries and allowances. Time now to look at the situation on the ground, beginning with Tana River County. It is one of the counties situated in the semi-arid and arid areas of Kenya, with pastoralism as the main economic activity. Tana River has a poor road network, and this is one of the main obstacles to service delivery. The county government says it inherited dilapidated health facilities, but there is great improvement with 30 newly built dispensaries in place.
Houses has been built for health workers, new health facilities have been put in place, the distribution of pharmaceuticals and non-pharmaceuticals being done timely, the procurement of 10 ambulances at a go at once. This was not the case actually. Previously, the entire county had only two ambulances.
Hapa hospitalini kusema ukweli kwa miaka iliyopita si kama vile ninaiona kwa sahihi. Sababu kitu cha kwanza naona ni safi. Kitu cha pili naona sijawahi kukosa dawa nikifika hapo hospitalini.
However, not everyone is happy with the state of service delivery in the health sector.
Hospitali sijui dawa yake zinaenda wapi. Unaona mtu amekuja kutafuta dawa, unaambiwa mara daktari hayuko, wale sijui wale wana dawa wanapeana wale wa hapa pharmacy. Mara nyingine unakosa yule mtu wa pharmacy. Usiku unakuja hapa unakosa daktari.
The health department, on the other hand, says despite the challenges, service provision is far much better than it was before devolution.
We've experienced exodus of staff to other counties, which has affected the service delivery in Tana River. Most of our experienced health workers who have been in the county have been seeking to go to their home counties, where by this has resulted to shortage of staff in the county.
From Tana River, we cross over to Kitui County, another vast county in terms of size, with a population of about 1 million according to the 2009 population census.
Kitui County, I will start by saying, is the 6th largest county in this country, with approximately 1,000 square kilometers in size, and with around 230 operational facilities spread not equitably across the county. And so there are many people who are not able to access or cannot meet the standard of 30 minutes walk or 5 kilometers radius to a health facility. So those people must be reached through what we call outreach services. And these ones have been supplemented by the Beyond Zero campaign. We received one van from Her Excellency the First Lady, Margaret Kenyatta, and the county was the first in the country to buy 2 extra mobile clinics, which are now working, and they are reaching services to the hard-to-reach areas of this county. And that has been able to make us reach many people. In fact, now we have been able to reach approximately 20,000 people through the mobile outreach clinics. These have supported maternal and neonatal child health services, antenatal immunization, and family planning services, among other services which those people are not able to access before.
The county government has invested heavily in preventive health care, emphasizing that prevention is better than cure.
Most of the conditions that bring our people to hospitals, 70% of those diseases from statistics are preventable. And what we have put as a county, we have said that by year 2020, we need to have reduced the number of people visiting our hospitals with the preventable diseases from around 70% to around 40%.
At the Kitui Referral Hospital, renovations are ongoing after many years of neglect.
In the old days, the roofing was asbestos, and we were having difficulties financing the re-roofing because asbestos is a dangerous metal. But the country has assisted us. Most of the buildings have been reeved, and the process is going on.
There's a new outpatient unit being constructed at the Kitui. The phase 1 is going to cost 60 million, and these are going concurrently with Mwingi and the Kitui Hospital. They are costing the same, they are identical, they are similar. And what the county envisages is that in the next 3 years, or before the 5 years are of the first term of this government, county government is over, would have lifted Kitui Hospital and Mwingi Hospital from level 4 hospitals to level 5 hospitals. Drug supply has never been 100%. You always have stockouts, but we have been able to go through the KEMSA system. The county government and Kitui has been fitted by KEMSA itself, being one of the most faithful customers in terms of supplies. So we supply and get our drugs quarterly from KEMSA.
In Meru County, one of the major healthcare campaigns is cancer screening, spearheaded by Phoebe Munya, the wife of Meru Governor Peter Munya.
We have reports from Kenyatta National Hospitals that suggest that 25% of the patients who are seeking treatment there, cancer treatment, come from our county. So for that reason, we sought to find out why our county has such numbers, and that's why we have come to the grassroots, to the villages, so that we can screen people. And from the results we're getting, we've already done 3 sub-counties, and this is the 3rd sub-county. We've already done 2 wards in this sub-county, and we can see the results actually suggest that we have high levels of cancer.
The turn-up is good, and cancer screening is not political. We just want to help our community so that our community will eradicate cancer in Meru County.
When it comes to the care of kidney patients, services at the referral hospital have received a boost with the installation of the dialysis unit.
Tulikuwa tunafanya dialysis Kenyatta, na sasa tuliona maendeleo ya kaunti yetu inatusaidia. Kwa sababu siku hizi hatuendi mbali, hatuendi Kenyatta, hatutumii transport, kwenda kulala siku 4 kwa floor, hatulali.
However, there is a shortage of staff.
Tungeomba kaunti iongeze manasi hapa na madaktari. Hatuna hata daktari wa figo.
Our next stop is Kakamega County, Kenya's second most populous county, whose population was about 106 million in 2009. Kakamega County inherited about 60 doctors. Now there are 120 doctors. The number of nurses, on the other hand, has increased by 400.
We have bought X-ray machines for all the level 4 hospitals so that we reduce congestion in the county general hospital. We have bought them ultrasound machines and laundry equipment. In collaboration with the national government, we have managed to introduce new services. We now have a renal unit, which serves a minimum of about 6 patients in a week.
The machines are making our work easier, but the personnel we don't have. So I'm requesting if you can be able to put in place machineries where we can get some personnel to operate the equipments.
When we receive specialists, some of them don't report and they opt to work in Nairobi. That's the challenge we are having, but we are trying to make the remuneration more attractive, give more allowances.
The other challenge the county government faces, she says, is erratic drug supply.
The problem we have with KEMSA is that they seem to be overwhelmed. Like we paid in November, they started supplying in February. And when they start supplying in February, they will supply level 4 and then hold back for some time before they supply the level 3, which are now the health centers, and level 2, which are the dispensaries. So you find we have paid for the drugs, but the drugs have not been delivered in our facilities.
That brings us to the question, how do counties acquire drugs? And are they tied to the Kenya Medical Supplies Authority?
We have a credit policy, we have a service level agreement with the counties, and we have also the agreed payment timelines or the credit period. Now, you will go down to the counties and they will tell you, we have done our procurement process, which they mean they have done the internal process and generated a local purchase order to KEMSA. Yes, that may be so, but that is just the beginning. Because once we receive that purchase order, we have to check your account. Is your account in order in terms of the service level agreement, in terms of the credit period agreed in a MOU? If it is not, that means it will undergo credit validation. If it's not, we'll come back to the county, talk to the relevant department in the county and say your account is not in order. You need to pay so much to regularize your account.
And what is the status of the intake of drugs by counties?
We used to supply 1.9 billion per year. Now we are talking of counties moving from 2 billion, now we are at 5 billion. And you can see that's nearly 3 times. It's almost 2.5 times.
We take a short break. We have more for you on the status of health services at county level. Stay with us.